Hi there. In this video, I will discuss a brief overview of sleep apnea. Who is most at risk for developing it, what happens when you have sleep apnea, and the benefits of treating it. Let's start with who is most at risk for developing sleep apnea. Patients with a higher likelihood for developing sleep apnea include, and this is just to list a few, those who are overweight and have a large neck or waist circumference, those who are older in age, males more than females, those with nasal blockage or sinus issues, patients with an anatomy that includes a more narrow airway. Now let's discuss what happens when you have sleep apnea. Sleep apnea is where there are episodes of complete blockage of the airway causing you to stop breathing or gasp for breath throughout the night. These are repetitive episodes of upper airway collapse throughout the night that usually occurs during REM sleep, and is where your muscle tone is relaxed, and in some patients this impairs the ability for the upper airway to remain open throughout the night. During this time frame, your brain is not getting the adequate oxygen it needs throughout the night. This in turn causes the symptoms of sleep apnea, such as excessive daytime sleepiness, inability to feel refreshed upon awakening in the morning, fatigue, morning headaches, etc. Sleep apnea causes a disruption to your sleep and the ability to cycle through the different phases of sleep. Next, let's review the benefits of treating sleep apnea. You will have a more restful sleep. You will wake up feeling more refreshed. It will reduce and/or resolve morning headaches. Your brain will be receiving the adequate oxygen it needs as CPAP keeps your airway open throughout the night via the pressurized air. It will also prevent and/or keep under control conditions such as, and this is just to name a few, high blood pressure, diabetes, depression, Alzheimer's. Essentially, if sleep apnea is left untreated, you could be prone to getting these conditions. If you already have these conditions, it could potentially exacerbate them. Sleep apnea is also associated with patients who also have thyroid disease. It can also be associated with patients who have a low testosterone level. Specific to treating sleep apnea with CPAP, it doesn't require surgery. It can be stopped and started at any time. It can be adjusted by your doctor as your situation changes.